try to make it interesting for you guys. And I have not spoken to high school students very often, and so I tried to look back at my life and think about, what were the things that were important to me as I grew up, and how did I choose my career, and do I find it meaningful, and why do I find it meaningful, and try to teach you guys a little bit about neurosurgery and neuroscience. So there are a couple messages that I want to sort of get across, and I'll show you some books that I read along the way that were important to me. But message number one is, no matter what you do in your life, and this is a little trite, but I'm going to say it anyway, and then I'm going to sort of talk to you about what it means to me. Find a passion, whatever it is. Maintain your focus on your passion. Figure out how to accomplish whatever you need to do to get it done. Everybody faces stumbling blocks, and I faced a million of them, and you will fall and then pick yourself back up. Nothing worth doing in life is easy. Everything is hard, but it's worth it. And whatever you do, try to be the best you can be at it, and try to achieve excellence. So what we study in the books is neuroanatomy, and it's really critically important. So I'm going to go through a little bit of neuroanatomy, very simple stuff. But basically, the brain has a frontal lobe, it has a parietal lobe, has an occipital lobe, and a temporal lobe. There are 4 lobes of the brain. And different parts of the brain are important for different functions. And we study all of these different functions in different lobes and the sulci and the gyri of the brain in school. And then this is what it actually looks like in real life. So when you expose the brain, it's a little gross, but this is the frontal lobe, the parietal lobe, the occipital lobe, and the temporal lobe. Is anybody going to pass out? Are you okay? So this is an actual patient that I operated on, and we exposed the brain. But what you see is that it looks like just like it does in the pictures, and you need to understand the anatomy that you see in the book so you can understand the function of the brain and what it looks like. There's also a very important artery that comes up through the neck called the carotid artery. It's right here. You can feel your pulse in your neck, and it goes up into the brain, and it literally gives the blood supply to the whole brain. So if you have a cut in that carotid artery, you would have a stroke, half your brain would die, essentially, and you could die from that. So, neurosurgery in the news. A year ago, this happened, and Mr. Goodman said that there were a lot of questions about that, and I put it in the talk, and it's relevant, but you all remember that Representative Gifford got shot, and she got shot in the back of the head, and the doctors said different things. They said, good news on bullet trajectory, surgeons encouraged, bullet didn't cross hemispheres of the brain. She could respond to simple commands, and says, quote unquote, this wasn't a little grazing wound through the brain. This was a devastating wound that traveled the entire length of the brain on the left side. So this is essentially the bullet trajectory, and as we learned about, so the reason she was in a wheelchair was that the bullet passed through the leg area of the motor and sensory area, so she couldn't move her legs, and she was in a wheelchair. And because it was on the left side of the brain, it went through a part of her brain that was important for language, and that's why she couldn't speak and had trouble with her speech. So a lot of the anatomy was very, very relevant. Now, I was looking at pictures online, and it turns out that exactly the same trajectory was the bullet that shot John F. Kennedy and the bullet that shot Abraham Lincoln, often because these people are shot from behind. And as a neurosurgeon, you see a lot of trauma. These are the emergencies that we do. We get called at 2 in the morning, someone gets shot in the head, and we have to go in and help them. And so what do we do? What's the treatment for this? Well, what a neurosurgeon would do, and what she had done, was because when you have an injury to your brain can swell. We have to give room for the brain to swell without damaging the brain. And so what we do is we open up the skin, and we actually remove half the skull. And we just take it off and we close the skin and let the brain swell, and then wait till the brain swelling is over, and then you can put the skull back. And what we do with the skull, believe it or not, is we actually implant it in the patient's belly. We make a little incision and store it there for a week or two until the brain swelling is done, and then we retrieve it and we put it back in. So that's an example of how neurosurgeons can do surgery and save someone's life, because if this surgery were not done, she would have died, for sure, she'd be dead. But she's alive now, she's still alive. And if a neurosurgeon were available for Kennedy or for Lincoln, they might have been alive as well. Innovation, I want to talk about innovation and collaboration, and one area in my work where I was able to innovate and do something new that no one had really done before, but only because I collaborated with someone else. And by collaborating with another person who has a different skill set than you, it gives you a new perspective and a new point of view and allows you to see things in a new way. And so I just wanted to emphasize how important collaborating is for innovation. So I'm going to talk about minimally invasive brain surgery because it's something that I'm interested in. So what is minimally invasive brain surgery? So the joke answer is, well, any brain surgery not done on my brain is minimally invasive. But really, it's brain surgery using endoscopes passing through natural orifices, such as your nostrils, or small holes in the skull. And what is skull base surgery? Well, skull base is really the hardest part of the brain to get to. It's the toughest part to get to because it's surrounded by all the blood vessels and nerves of the brain. And in order to get there, you have to move the brain out of the way and make very big incisions. And there's a lot of risk to doing it. So if this is the top of the brain that I showed you before, if you take the brain out of the skull and you look straight down, this is the skull base. So the question is, how do we get to this area of the brain? Because the brain's in the way. And there's also a lot of nerves and blood vessels around there. So this is that skull base area. So rather than going from above, the idea is to go from below. And we can use endoscopes, which are like long, thin telescopes, and go up through the nostrils and then reach this entire area of the brain in the skull base just by using the nostrils and not opening up the skull at all. So that's a lot of the work that I did, and a lot of the innovating I did was doing that. But in order to do that, I had to work with an otolaryngologist who's an expert in working through the nose. And only by collaborating with another surgeon who worked through the nose were we able to develop these techniques. So this is a woman named Svetlana who comes to see me with this big brain tumor. This is a big tumor on the skull base. And you can see you can come in from above to try to take this thing out. This big white ball shouldn't be there, but you can also come in from below. This is a sinus. This is an air-filled cavity. So once you go in there, you can actually work to take this tumor out. So there's the tumor. This is how we used to do it in the past. You would make these incisions in the face and actually remove parts of the bone of the skull. It was a very hugely disruptive operation. And you can see you could work through the eyes and work through the nose in order to get back to the skull base. Or you could work through the mouth and put all these retractors in. And really what this would get to you, where this would get you is the same place that we can get just using an endoscope. So this is, Vijay Anand is the sinus surgeon that I worked with, the ENT surgeon. And by collaborating with him, we developed a way to go through the nose with this scope to get where we need to get. So this is just a cadaver picture of working through the nose. So this is what the surgery looks like. We do our whole surgery with a scope going through one nostril and our instruments going through another nostril. And we're looking up at a TV screen. And we can get a lot of instruments, believe it or not, through your nose.
What was your proudest moment as a surgeon?
That's an interesting question. You know, I think one of the moments I remember was in my first year in training, there was and I told this story to Robert, he'll remember it. There was a girl who was riding a horse, and she was probably 8 or 9 years old, and a motorcycle came by, scared the horse, she fell off, she had a helmet on, but she hit her head. And she was brought by helicopter to the hospital where I was on call, and she was going to die. And we did almost that operation where we very quickly took out the skull and took the blood out of her that was pushing on her brain that was growing. And then we put it back together at the time, and she was in a coma for about 2 months after surgery. And I had a very close relationship with her mother, who was scared to death that her little daughter was going to die. And a lot of the doctors told her mother she's never going to recover. And I said to the mom, she is going to recover. And sure enough, after about 2 months, she started to move her hands, and she made a complete and full recovery. And to this day, I get a Christmas card from them every year, and showing me her picture and her accomplishments. So.